Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. I'd like to acknowledge the traditional custodians of the land on which I am recording this podcast, the Gadigal people of the Eora Nation. Pay my respects to their elders, past, present and emerging. Well, today we continue our journey into holistic medicine. We are talking to a world leader in holistic medicine. My guest today is Dr. David Brownstein. He's a board-certified family physician. He's one of the foremost practitioners of holistic medicine, I think globally, and is the medical director of the Center for Holistic Medicine in West Bloomfield, Michigan, in the United States. He's lectured internationally to physicians and others about his success with using natural hormones and nutritional therapies in his practice. He's written 16 books, all of which are very accessible to patients. So we will, of course, have links to that. I hope you enjoy this conversation I had with Dr. David Brownstein. Welcome to the show, David.
Thank you for having me, Dr. Ron.
David, you've got many years of experience in holistic medicine. You have written 16 books, incredible, and you've lectured internationally. I mean, you are a world leader in holistic medicine, and I'm often intrigued why everybody isn't practicing this. Can you just share with us a bit about your journey?
Well, I'm questioning why everyone isn't into this as well. But my journey began about 30 years ago. I didn't grow up in a holistic household. I grew up in what I would call a conventional average household. We didn't go to the doctor much. We went when we were sick. We took whatever they gave us. We never questioned anything. We didn't take vitamins. We didn't go to chiropractors or alternative healthcare providers. We just used our family doctor. And I grew up with a severe case of asthma. And so I saw my family doctor a little more than my sisters did. And I decided that I wanted to be a doctor as a little child, as I just found it fascinating to medicine. I always found interesting and mysterious. And I always liked science. And I figured I wanted to be a doctor to help people. So I geared my undergraduate training to go to medical school, went to medical school, did a family practice residency because I wanted to model myself after my family doctor, and started practicing conventional medicine. I'd never taken a vitamin in my life. I used to tell my patients, don't take that because it's just giving you expensive urine. So I was practicing medicine as I was taught. I didn't deviate one iota, and I was going to be a partner in this practice. I was in 6 months practicing and then had a lawyer. We were negotiating sort of a buy-in for partnership at a year. And then suddenly around that 6-month mark, as negotiations started, I lost sleep for an unknown reason for a few nights in a row. And that was unusual for me at that time. And after the third night of not sleeping good at all, my wife and I are getting ready to go to work, getting up, in the morning, doing our thing. And I just blurred out to her, I don't want to be a doctor anymore. And I've been doing this 6 months. And she said, she looks at me. And her first comment was between her and I is we had $100,000 in student loans. And this is all I wanted to do. She knew me since I was 18 years old. I mean, that's all I wanted to do. And she said, the second comment was, what's wrong? And I said, I don't know, but I'm treating people with all these drugs. I'm spending 5 minutes with them. And I said, I don't really know them. And I'm having to treat more drugs with the problems from the first drugs. And no one's getting better. And I said, it's not fun. This is just, a monkey could do this. And she said, well, why don't you do another residency? And I'm like, nah, one of those was enough. She goes, what are you going to do? And I'm like, I don't know. And anxiety came at that point, and, I felt a little bit lost. And, the next day, I still didn't sleep that night either. The next day I see this patient, and this patient had been bothering me to meet his chiropractor for years. Now, his wife and my wife worked together. We had done things socially with them, and he had been talking about this chiropractor for a couple of years. I never referred to chiropractors. I used to tell people, don't see them. They're dangerous, even though I never met one, never knew the philosophy, never knew what they did. And he said the chiropractor helped him more than just adjusting him. He was giving him vitamins and minerals and things. And he was really smart, and he thought we'd get along. So in my lack of sleep and anxiety, and I don't think I was all thinking clearly, because in my regular conventional state of mind, I would have said, I'm not meeting any chiropractor. But I set up a dinner meeting with him for the following Tuesday. The following Tuesday rolls around, and I'm still anxious, still not happy with what's going on. And, how am I going to do this for the next 30 years? I come home from work. It was Tuesday. I said to Allison, I'm going to cancel this dinner meeting. It's a waste of my time. And she said, that would be rude. You already scheduled this. You have to go. And she told me to be nice as I was walking out the door. So I get to the meeting, get to dinner. He's a nice guy. We hit it off right away. He's funny. He's interesting. He's talking about functional biochemistry. I mean, we all learned biochemistry in medical school and undergrad, and then you just learn it to pass the test. It doesn't really make any clinical sense to you the way we learned it. Mm-hmm. And he's talking about functional biochemistry, which, he knew a lot more about it than I did. And we had a nice meeting. And then at the end of the meeting, and then end of dinner, he hands me a book, Healing with Nutrition by Jonathan Wright, who's an allopathic physician. I take the book home. I stay up till 2 a.m. reading that book. And I focus on the chapter on cardiovascular disease. Now, my dad had his first heart attack at 40, his second heart attack at 42. In the intervening 20 years, he had 2 bypass surgeries, numerous angioplasties, and he was on 12 medications to control blood pressure, diabetes, congestive heart failure developed at that point. But he had congenital angina for the last 20 plus years. If he did anything at that point in time, he got chest pain, short of breath, and popping nitro pills like he was taking candy. So at that time in my life, I was waiting to get the phone call that he died. My whole family was. We knew he was going to die at any moment. I mean, it felt like it. He looked bad. He was gray and pasty. I mean, literally, he couldn't walk a block. Couldn't walk down the driveway without getting chest pain and having to pop a nitro pill. So I read that chapter on cardiovascular disease twice that night till 2 a.m. I called my dad on the way to work, or before I left the home. That might have been before cell phones. I can't remember that. But I called my dad before work, and I said, I want you to come in the office on the way to your work, and I want to draw some blood tests on you. So based on what I read in the book and what I talked about with Dr. Robert Radke, who was that chiropractor that I met, I drew 2 blood tests, two blood tests on him, a complete thyroid panel, which he'd only had TSH levels drawn, and I drew a T4 and a T3, and I drew his testosterone levels, which had never been drawn. So a couple days later, I get his blood work back, and his thyroid levels were in the reference range, but in the lower part of the reference range. And his testosterone levels read as below detectable limits. They weren't reading on the test. They were so low.
And he was in his 60s at the time?
He was in his 60s. So
having had cutting edge medicine, whatever year that was the best medicine could provide.
He was seeing the best doctors in the area. And
absolutely.
So he's on medication for cholesterol, for hypertension, for diabetes, 12 different medications at that point. Mm-hmm. So I put him on natural desiccated thyroid hormone and natural testosterone topically. Within 7 days, he calls me up and he says, I haven't had chest pain today. It's the first day, and you can remember, 20 years or so. And he says, I think I'm feeling better. And then, over the next 2 or 3 weeks, we're talking and he's feeling better. He's not getting chest pain. He's actually doing things. He liked to fix things. He was very handy. He would go in the garage and cut wood and make things and fix things. And he was back to it. And my mother was telling me, he looks totally different. And, what are you doing? And they went out to dinner with some friends in that time period. And her wife of the other couple said to my mother, what's he doing? He looks so much better. I want to do this for Leonard, So 3 or 4 weeks later, I redo his blood tests, and his cholesterol levels stuck in the 300s. We're now below 200 without changing any of his bad habits. And my dad had a lot of bad eating habits, and he smoked. He was overweight, never exercised a day in his life. And so his cholesterol falls 150 points without changing anything. His blood work looked markedly better. He looked markedly better. Instead of gray and pasty in his face, he was pink and looked much healthier. He's doing work outside. He's taking walks. Feels like he's been sort of reborn. And once I saw the changes in my dad, I knew that's what I wanted to do in medicine. And I went to the partners and I said, I got rid of my lawyer. And I said to the partners, I need to leave. And they said, what's wrong? And I said, nothing's wrong. Like the practice, like you guys, but I need to I want to practice holistic medicine. They go, what's that? And I said, I don't really know, but I'm going to figure it out. And they said, well, why don't you do it here? We'd like you to do it here. I'm like, I can't do it in this office. I need to be in an office where I told them this. I said, I need to be in an office where the front desk people, the nurses, and the doctors, we're all on the same page. We're all doing this holistic medicine. And And they said, okay, well, they said, if that's what you want to do, that's what you want to do. So I left, I did a 180 in medicine, and I started reading and going to conferences and educating myself about what I really focused on from that moment on was, number one, the hormonal system, getting the hormonal system rebalanced, and really looking at thyroid in every single patient. And I have done that for close to 30 years. Every new patient that comes in gets a full hormonal and a full thyroid evaluation. And I started looking at the biochemistry of people and pulling out my biochemistry textbook and looking at the pathways and just trying to use things that optimize human physiology and biochemistry. Instead of using drugs and medicines, they poison enzymes and block receptors 99% of the time. They don't optimize your biochemistry and physiology. They poison and block things. And there's a time and a place to use those things. I mean, you're having an acute heart attack. You want to be in the nearest emergency room where they're skilled to use heart attacks. We have dropped the mortality from acute heart attacks tremendously using drugs that poison enzymes and block receptors. But that's an acute thing. You want to keep your body healthy so you don't have to do that. And if you do that, then it's available for you. But I began just sort of looking for things that support the human physiology and biochemistry. And here I am 30 years later, still learning about holistic medicine, but I have a better idea what it is now. And, I'm much happier, and it's been a great way to practice medicine. It's been very fulfilling and very interesting, and it's always changing. You're always, hopefully always learning more and becoming better at it. And the reason they call it practicing is because you can't ever master this thing. You just got to work with it and work hard at it. And that's where I'm at.
Do you think that's one of the issues around, you've said so much there that I feel very familiar with, but the more you learn, the more you realize you don't know. And that is empowering to people who practice holistic medicine. But I wonder whether that's what stops a lot of people from practicing holistic medicine, is that uncertainty.
It's more than the uncertainty. Here we learn medicine. We go to undergraduate, take all those science courses. Most of them you don't need, right? Most of them were just weed out courses and just ridiculously silly that doesn't make you a better doctor. It doesn't, you don't need it. But whatever, you have to pass them. You have to get good grades. You have to pass them. You take that test for entrance to medical school. That's a pain. You get to medical school. The first 2 years, I don't know about you, I was not happy with it. And it was just too much material and too many tests and too much regurgitation. And, you go to your clinic years, which were better, but you are taught this is the way it is. These are you're taught about pathology, how to diagnose pathology, and then how to prescribe that one drug to treat that pathology. That's it.
Yes.
And you're taught to add another drug if you diagnose something else or something's not optimized with it, but you are using drugs that work by poisoning the enzymes and blocking receptors. That's their focus. You never learn about health. You don't learn what health is, how to optimize it, or even how to just help it improve. You're learning about pathology and how to manage diseases. There's no health that was taught. In my medical training back then, we look close to the same age, I think, but in my medical training back then, I recall we had a 3-hour nutrition class. Now, I studied a lot in medical school. I don't know about you. It didn't come easy for me. I worked really hard at it. And so I didn't go to class too much. I studied. I was screwing around, but I was sitting there reading and taking notes and making note cards and, memorizing, and just that's how I learned the best. But I went to that 3-hour nutrition class. And what that nutrition class, when I started to do this stuff after meeting Dr. Radke, I pulled out I kept all my stuff. I pulled out that 3-hour nutrition course back that we got. And the only thing we were taught on nutrition was severe vitamin C deficiency is scurvy. And these are the symptoms. Thiamine deficiency is congestive heart failure,
Pellagra.
Things like that. You weren't taught.
Yeah.
And then these were all the things of the past, and they don't exist anymore. That's what you were taught. And when I look back on it, you learned in that 3 hours, maybe something in 5 minutes, and the rest of it was just not true.
Yeah. But we were taught biochemistry, but if we had only been taught biochemistry as a nutritional explanation, that would have been fascinating. Or physiology. I often say if I had the choice of what I would go back and study, I wouldn't do a PhD. I'd go back and do biochemistry.
All of us say the same thing. We're in holistic medicine. All of us. Biochemistry look at those, look at those pathways and figure out how to optimize them. And then you can look at those pathways and figure out, well, how to disrupt them. And how you disrupt them is with drugs, the poison enzymes and block receptors. And so I 100% agree with you. We have a biochemistry group that we used to meet once a week. We're not meeting as much anymore, but we need to get back to that. And we would pick parts of the pathway and discuss it and, just discuss how we can manage it and what happens when it gets disrupted. And that's how it should have been taught to us. And it wasn't. It was really taught to us in a format that you were just trying to survive and pass the test. And then when it was inside from this ear to here, after that test was done, it flew out over here and then you forgot about it.
Which comes back to why more people aren't practicing holistic medicine, because I think the prescription pad and the acceptance of that by both patient and authorities and profession is so ubiquitous that you kind of think, well, why would I? In fact, your partner said, what's holistic? So
here's part two of the story. So one of the partners in that practice was Dr. Rick Ing, who's my friend. Him and I were playing tennis. I was playing tennis with him when I was a resident. He was 10 years older than me. I wanted to join his practice because I liked him. And we were playing tennis, and he was a friend. And he was the one I told I have to leave and what's holistic medicine. So I leave. I start doing this holistic medicine. Him and I continue playing tennis twice a week. So after we were done playing tennis, we would go in this little spa hot tub thing, that was in the club together. And I would tell him, hey, I went to this course and this is what I learned, or I'm treating patients with this. And it's really fun. And so about 5 years later, I said to him, and he never said much in the hot tub. He just listened to me. 5 years later, we're in the hot tub and I said, hey, Rick, I wrote this book on natural hormones. I need a conventional doctor to read it. Just give me your honest opinion. What do you think of it? And he goes, sure. So I print it off. I give it to him when we're done. Calls me up over the weekend and he says, is all this true? I'm like, Rick, I've been telling you this in the hot tub for 5 years. And he goes, well, I don't like what I'm doing. This sounds much more fun and interesting. Can I join you? And so we make a plan. He's going to join me in a year. And shortly after that time when he said that, I'm down at my desk working at the end of the day, and his wife shows up in front of me, unannounced. And I look up, I'm like, hey, Rosa, what's going on? And she goes, I'm not happy with you. And I'm like, what's wrong? And she goes, he's walking away from a practice. He's a partner. He goes, what are you doing? I'm like, Rosa, we're going to have more fun. We're going to make more money. We're going to do okay financially. I don't know if we make more money, but we're going to do okay. This is way more fun. And I want to work with him. And she points her finger at me and she says, if you guys fail, I'm coming after you. She goes, you're going to hear from me. And she goes, we got 2 kids getting ready to go to college. And, I don't want them to walk away from this. I'm like, Rosa, we're going to do fine. And we're going to have a better time, much more interesting time doing it. So needless to say, we did fine and we're busy and we're financially fine.
Right. And you've used this word, we have much more fun. And I love that because managing chronic disease and writing prescriptions, which are it's a great business model. I mean, I think the $1.2 trillion that the pharmaceutical industry generates every year, $1.2 trillion. We've got a lot of agents out there writing prescriptions, and that's not all that much fun, but it is medicine as we know it. More fun is actually working out why people aren't well and helping them.
Trying to get to the underlying cause of maybe why they're not feeling well. And, I always tell people it's not, you don't have a deficiency of statin drugs in your system. You don't have a deficiency of hypertensive drugs. Maybe you have a magnesium deficiency, or maybe you have a thyroid hormone deficiency, which is known to cause elevated cholesterol levels. And maybe that's what turned my dad's cholesterol down 150 points,
Yeah. Well, now as I mentioned at the beginning, you've written 16 books, which is just phenomenal. And I think my first book that I read of yours was Thyroid and the Iodine book. And I remember seeing photos of you at the time, and you had much darker hair in those days, as did I. But let's start with Thyroid and Iodine, because you hit on that with your father, but it's a big problem for a lot of people. Talk to us about iodine and let's talk about Thyroid 101, why it's important, and iodine and how common deficiencies are.
After treating my dad, every patient that walked in the door got a hormonal and nutritional evaluation, but really with a major focus on the thyroid. So the thyroid gland sits here in the lower part of the neck. It weighs about 1.5 ounces, and it produces a teaspoon of thyroid hormone for a whole year. That teaspoon of thyroid hormone has to interact with every single one of the trillions of cells in your body 24/7, 365 days of the year. So to have good health or optimal health, you have to have adequate thyroid hormone to do it. So, here my dad was any conventional doctor would have looked at his thyroid lab and said they're fine. I looked at him from what Dr. Radke had taught me and what I read in that book, that here's the reference range. He was in this lower part of the reference range. Maybe he wasn't optimal. So there's a lot of literature to support treating people with that. And so I started putting people on thyroid hormone who were low or, I was taught in med school back then to just check a TSH level. Now they teach them to check a TSH and a T4 level, which is better. But T4 is the inactive thyroid hormone. T3 is the active thyroid hormone. Why aren't we checking free T4 and free T3 levels? We get more information out of that. And then, to boot, you should check a reverse T3 level. That's part of the thyroid pathway that gives you a lot of information. So once I started checking all these levels and checking thyroid antibodies, all of a sudden I started diagnosing all these people with thyroid problems and putting them on thyroid hormone. Their cholesterols were all dropping, just like my dad, a lot of people. And most important, they were feeling better. And I felt like I was treating an underlying cause of their problem and helping them out. That was about the first 10 years of my holistic practice. And I would estimate at that point, I had approximately 3/4 of my patients on small amount of natural thyroid hormone. It bothered me during that time period periodically why all these people need thyroid hormone. I mean, it's not like I think we were designed just because we're getting older, we need thyroid hormone. So I look at the biochemistry and the physiology of thyroid hormone, how it's produced in the thyroid gland, what cofactors are needed. And I would, I pull my biochemistry textbook out and looking at this stuff. And, I would try various cofactors like selenium or magnesium, and iodine would come into play there. So nothing helped people like thyroid hormone. I mean, you put people on thyroid hormone who are low thyroid, they felt better, their arthritis got better, their brain gets better, they're easier to lose weight, their hair gets better, many things get better with thyroid since it affects every single cell in the body. Well, I kept coming back to iodine because the highest concentration of iodine is in the thyroid gland. You can't make thyroid hormone without iodine. And I live in the Great Lakes area of the United States, which Michigan, if you look on the map, Michigan's the mitten on the map, and there's Great Lakes surrounding our state. And our soil is one of the most iodine deficient areas of the world. And the states surrounding us have very low iodine levels. So I knew we were in what's called the goiter belt of the United States. And back in the 1800s and early 1900s, there was a huge goiter problem across the U.S., but really concentrated in the Midwest where I live in Michigan. So I figured we were all iodine deficient. There was really no testing for iodine at the time. And I would try iodine on and off over the first 10 years, and it didn't help. People didn't feel better. They didn't feel worse, but they just didn't feel better. I would use little doses, medium doses, large doses. There was no side effects that I could really, in the vast majority of people, that I could say, but they didn't feel better. And the blood work wasn't really changed much. Now, around 10 years into practicing holistic medicine, in one of my journals that I get, this physician wrote a letter to the editor about an iodine loading test that he developed. So I became interested right away in this gentleman. Dr. Guy Abraham was his name, because there was no testing for iodine that was really accurate at that time. So I called him, found his number, called him. It was in the 1990s. And he, it took persistence on my part, but, he was very unsure of strangers, and he felt people had not treated him correctly over the years professionally. And he was very rough on me at first. But he started sending me articles that he had written, and I would read the articles, call him back, trying to discuss it with him. And then finally, once he realized that I wasn't going anywhere, he warmed up to me, and I flew out to California to meet him. We hit it off. He said to me, well, I'm interested in you because you're in the goiter belt of the United States. You have low iodine in your soils. Everyone's going to be low iodine there. And he says, let's do some testing. So I started collecting urine from patients and sending them urine and finding 97+% of my patients were low in iodine. Very low. Most of them significantly low in iodine. Now, what I was doing wrong the first 10 years is I was using just iodide, IDE, iodide, the reduced form of iodine. So it's the clear iodine, and if you see a liquid of it, it's a clear, it doesn't have any color to it. What I didn't know, and Dr. Abraham taught me, amongst many other things he taught me, was that different tissues of the body bind iodide, the reduced form, and different tissues bind iodine, the oxidized form, INE. And now the thyroid, interestingly, primarily binds iodide. It needs iodide to make, but it absorbs iodide. But so you would think that iodide, the clear stuff, should be the right form of thyroid, iodine for the thyroid, but it didn't work. Once I started using Lugol solution, which is a combination of iodine and iodide that Dr. Abraham had been writing about, wrote all these articles before me, and he educated me on why it didn't work. And, when I started using it, people's iodine levels improved. But beyond that, that's not that important. What's really important is they felt better. And they started getting better energy, better brain function, better hair, all the stuff that the thyroid was doing for my patients before. But now I found a few years later, after testing thousands of patients, finding still over 97% low in iodine, that instead of 3/4 of my patients on thyroid hormone, I have about less than a quarter. And so I've dropped my need for thyroid hormone because I'm using the thing, iodine, that is physiologically and biochemically important for making thyroid hormone. That was a deficiency people were having, not thyroid hormone. Now certainly a lot still need thyroid hormone, but they need less. My average dose of thyroid hormone went from about 2 grains, which is 120 milligrams of desiccated thyroid, down to 30 milligrams in most people. So I was able to lower the amount of thyroid hormone people needed just from giving them iodine. Now, I wrote about all that in my book, and what I've also found is that iodine is needed to make any hormone in the body: adrenal hormone, ovarian hormone, testicular hormone, pituitary hormones. It doesn't really matter. You can't make any hormones without iodine. So here I was looking at the hormonal system and trying to balance it, and I was missing a key nutrient that people were deficient in. And if you look at from the U.S. government, the NHANES data, National Health and Nutrition Examination Survey, which is done every 10 years, iodine levels across the U.S. have fallen over 50% over the last 40 years. I came to Australia and lectured, I don't remember how many years ago now, 10 years ago. Everybody had dark hair then too. And so I looked up the data from Australia, whatever it's called, and I had slides on that. The levels of iodine across Australia had fallen too. You guys have iodine deficient areas just like we do in the major population centers. And your levels were not much different than ours. And so if the government and the powers that be come to my practice, which unfortunately they have, and they say to me, we don't like what you're doing. You have to stop all this holistic medicine stuff, go back to practicing conventional medicine, but we'll give you one thing to take with you. And that's all you can continue doing holistically. Iodine would be it. Without it, I wouldn't have to think about it. Iodine is a single nutrient that helps more people. It's inexpensive. Every cell in the body needs it. And, it helps so many different biochemical and physiologic pathways that's the one thing I would keep.
And tell me, with the iodine, and you mentioned Lugols, I had heard that you could put a Lugol on your skin and leave it on there overnight, and if in the morning there was a difference, like it wasn't there anymore, you'd kind of pick up that it was iodine deficient. Is there a truth to that?
So that's been talked about, in holistic medicine, and I read that too. Mm-hmm. And there's a study that looked at this, and what they found was that 88% of the iodine that you paint. So the theory was, since iodine, the oxidized form, is brown, when you put it on your skin, it turns the skin brown. Those of us can recall putting iodine on the skin when we were young and we had cuts, remember that. But so the brown will go away. The theory was that as iodine is absorbed into the body, the brown goes away. So the theory of what you're talking about is, if the body's really deficient in iodine, you put it on the skin, it turns brown, it'll go away fast because the body's absorbing it super fast. If you have enough iodine, it'll stay longer. So if it stays over 24 hours brown, then theoretically you have enough iodine in your system. And if it goes away sooner than that, you don't have enough iodine. Well, if it's supplementing off into a gaseous phase, that's irrelevant. That doesn't really tell you much. The other thing to keep in mind is the skin holds about 20% of the body's iodine. I don't know the exact numbers in my head right now, but the highest iodine concentrations are in the fat and the muscle of the body. Thyroid only holds a small percentage, about 2% of the body's iodine. So maybe what you're measuring by the skin is just the skin iodine level. I don't know. But if 88% evaporates into a gaseous phase, it's not a good measure. The best measure is a urinary excretion test.
Right. And the other thing you mentioned soils deficient in your area. Well, I can tell you in Australia, our soils are deficient in zinc, magnesium, selenium, I remember doing a podcast many years ago with Professor Cresswell Eastman at Sydney University, and he said iodine deficiency was the biggest deficiency in the world. 2 billion people suffer from iodine deficiency. Now, going back to high school chemistry, when we looked at the periodic table and we see iodine is part of the halogens, which include bromine, chlorine, fluoride, when we think about how ubiquitous those chemicals are, do they displace iodine from the thyroid gland?
So, if we could all take our heads back to high school chemistry, although you learn this in college too, and you learn somewhat of this in med school, although you're just trying to survive and you don't really remember it. But, if you look at the periodic table, which has all the elements that are known to mankind, group 17 are the halides. And the halides are fluoride, chloride, bromide, and iodine. There's a new one, astazine. There's no human need. We don't think that's in the human body, but so the 4 major halides are fluoride, chloride, bromide, and iodine. Out of those halides, 2 are essential that we cannot live without. That's iodine and chloride. And 2 are non-essential we can live without and are probably toxic to us. Bromide, they're toxic to us. I mean, they poison enzymes and cause problems in the body. That's bromide and fluoride. So as you mentioned, the halides, too much of one halide can competitively inhibit another halide. So if you have too much bromide, it'll push iodine out of the body, and the bromide will bind to iodine receptors. And there's animal studies that show that when you put bromide in the food source of the animals, they will start brominating the thyroid hormone. So unfortunately, in our modern world, you guys don't fluoridate your water, I don't think, like we do.
Yes, we do. Yes, we do.
Right,
yes, we do. We are very
good for you.
We are. We do? Good for you?
Yeah, good for you. So we don't have to be the only miserable people out there. So fluoride.
Okay. I was going to say.
Fluoride's an electronegative, very electronegative halide. It's highly reactive in the body. It poisons multiple enzymes in the body. It's not a good thing that we should be putting in our water supply. And regarding fluoride in water for tooth decay, that's been disproven by the WHO studies, and that's all nonsense. But so we are getting too much fluoride, and we're getting too much bromide in food and drink and in consumer items, and we don't have enough iodine. So what's happened over the years is, as iodine levels have fallen across the world, which they have, the world's become more toxic with fluoride and bromide. So our iodine deficiency is actually worse than our ancestors had. This is why, this is my premise is this is why we're suffering all these health problems, and we spend all this money on healthcare, and, we're having some major problems. And if you look at countries that have high iodine intake, like Japan, they have the longest longevity, longest lifestyle, of any country out there. And, the U.S., which spends 20% of our GNP on healthcare, we're last compared to every Western country out there. You Aussies aren't much better. Your healthcare isn't so good either. I remember when I lectured there and I studied up on it. But you're better than us, but that's not hard to do, in our state.
Yes, no, with all due respect, I don't think the United States sets the bar very high when it comes to healthcare. No. Now, another, and actually interestingly, before we leave thyroid, because you mentioned something else which I think is really important, and that is that the thyroid hormone is important for every cell in the body, trillions of cells. Every cell needs thyroid. And I think vitamin D is another one. Those two are essential for every cell in the body. And I'm sure we're going to come back to that when we talk a little bit about viruses. But another book that you wrote that I think challenges the norm is on salt. And it's been demonized. Talk to us a little bit about salt and how we've got that wrong.
So when I started looking at people, how to optimize their health instead of just diagnosing, look, I still diagnose pathology on people. I still do what I was taught in medical school, which is take a history, do a physical exam, order lab tests, and then try and put it all together. But what I was finding, I was taught in med school, any salt is bad. Any salt can cause hypertension. The lowest salt you can put people on, the better they'll do. So I used to tell people, don't eat salt, remove salt from your diet, and, whatever. Most people wouldn't do that anyways. But I started really looking at my laboratory tests, and we started having these biochemistry meetings with my local practitioners here. And what I realized, when I started looking at the biochemical pathways, sodium and chloride were so important in all these pathways to make ATP molecules or energy molecules. To make thyroid hormone, you need sodium. You need sodium to usher iodine into the thyroid gland. If you don't have enough salt, that's what really started me when I learned about the sodium iodine symporter. It's a little taxi cab that takes iodine from the bloodstream and moves it into the thyroid gland or the breasts or the other glandular tissue against the gradient. So you're having to use an ATP molecule to do that. Well, you need 2 sodium molecules for 1 iodine molecule to do that, 1 iodine atom to do that. So I started really looking at salt levels and electrolyte panels and fasting blood work. And what I found was that the optimal sodium level should be 141 or higher. The optimal chloride level should be, I need my lab slip in front of me, but I believe it's 102 or higher milliequivalents per liter. And most people were deficient in that. So I started having people try salt. And I had them use unrefined salt, which is full complement of minerals in it, not use refined salt, which has had all its minerals removed out of it. And lo and behold, they had leg cramps, they felt better. They had muscle cramps, they felt better. They had aches and pains, they felt better. They felt better in their brain. And very few people swelled up with salt. Very few people got high blood pressure. Very, very few. And interestingly, I was able to take people off their high blood pressure medications once I put them on salt. So I'm like, well, this is interesting. Their blood pressure is lowering. Why is that? I went back to my physiology and biochemistry and realized that what happens when you lower sodium levels in people? You trigger all these hormonal responses in the kidneys. And what happens? You release aldosterone, which is a hormone that helps you hold on to sodium. And it releases renin and angiotensin and all these things, these hormones produced in the kidneys to try and help you hold on to salt, but it constricts the blood vessels and makes high blood pressure go up. The worst thing you want to do in a hypertensive patient is put them on a salt-restricted diet. You're going to make it worse. And what do we give them for hypertension? We give them antihypertensive medications that block renin, angiotensin, and aldosterone. Those are the mainstays and diuretics that pull sodium out of the body and make them dehydrated. And those are the mainstays of conventional medicine for treating hypertension when they may just be salt deficient. So if you have normal kidney function, people need adequate amounts of salt. I wrote a book called Salt Your Way to Health. And the book was written, I write a book for one of 2 reasons. I get excited about something or I get irritated about something. And I have to have some passion for it.
And hence the 16 books. I
have to have passion to put something in a book because it's a lot of work and I'm seeing patients.
Yeah, it's cathartic.
It is cathartic.
Very cathartic.
It's very therapeutic for me. So I was writing my iodine book, one of the additions to it. It's on its 5th edition. And I was finishing the edition of the iodine book. I think it was the 5th edition. And there was an article in my local paper from a dietitian on why no one should have salt added to their food. Everyone should have minimal salt. And I cut it out and I taped it over my computer screen so I could see it. And it just irritated me. And so as soon as I finished the iodine book, I started writing the salt book. And I still have that article. I took a picture of it and I still use it in my lectures. And I went through the whole history of salt and why we stop using salt, just like why we stop using iodine. I described that in my book. And when you go through the history of it, you realize there's no science behind that. It was kind of there was a little smoke over there. And then they just took it and ran with it. And they just made it, you just say it enough times, people start believing it. But there's really not good science behind that. Are there some people who need to lower salt in their diet? Sure. You have kidney failure, you have heart failure. Those people sometimes can't handle it. If we have normal kidney function, you can handle over 100 grams of salt in a diet. No one's going to eat that much because physically, I don't think you can do that. But you can handle, decent amounts of salt if it's good salt, and for a lot of people, it helps lower the blood pressure and helps their whole health status improve.
And you mentioned refined salt, so not all salts are the same. What are, like Celtic sea salt or Himalayan rock salt? Are they the unrefined?
I was just looking for a copy of my salt book, but I don't have it at hand. The salt can be refined or unrefined. So For those listeners out there, we don't want to refer to salt as sea salt because all salt came from the ocean at some point in its life.
Yeah.
And salt's been very important in human existence from the beginning of time. Countries and groups of people would only be able to survive where there's salt, either salt in the environment or they had to get salt somewhere because we can't live without it. And humans would crave salt when they got low on salt. So when we refer to salt or we're talking about salt, we should all say refined or unrefined. Those are the 2 types of salt. Refined salt's a thin, very thin stuff. It's in restaurants. It can go through the small little holes in the salt shaker. Unrefined salt's a little thicker. It's got a color to it because it's got some minerals in it. Unrefined salt will have its complementary minerals and wherever it comes from and whatever minerals are high in that area, and it gives it some color to it. And the salt industry looks at that color as sort of dirty. And so they they take it out, they bleach it, make it white, and they think we like it better because it's white. But it's really not a healthy salt as the refined salt. So unrefined salt, like Celtic brand sea salt, there's a few of them, and those are better forms of salt. And in my book, I talk about which forms of salt to use and how much to use.
The other, you mentioned there's a fire, a little fire over there called salt, and so we've hung a lot of, we've given it a lot more credence than it needs. Cholesterol's another one that similarly, it was a simple message to pump out, wasn't it? It's like don't eat fat because you'll get fat.
So that's how
cholesterol causes. Yes, the statin disaster, and we're on the cholesterol skeptics group, which is a very interesting group of highly qualified people like yourself. Talk to us a little bit about how we got cholesterol wrong and statins. We're not.
So I started. So my dad was my first and my best patient, and his cholesterol level drops about 150 points from just going on thyroid and testosterone without changing his diet. And he, like I said before, my dad could eat like the best of them, and it was obese and smoked and didn't take good care of himself. But here his cholesterol drops on cholesterol lowering medications, that wasn't dropping his cholesterol. And so as he got better, within a short period of time of doing that, took him off his cholesterol medications, and his cholesterol stays down and he feels better. So I started researching cholesterol. And when I knew there was a relationship between cholesterol and thyroid, that if you're low thyroid, you can have high cholesterol levels, and taking some thyroid hormone can help cholesterol levels. So statin drugs came on the scene when I was a young physician in the 1990s. And, they took off because Americans are overweight, we're in bad shape, and they eat like my dad was a typical American. And so, miserable lipid panels and high triglycerides and stuff were out there, and people are getting heart attacks, too young and all that stuff. So we were taught in med school not only any salt is bad for you and low salt, no salt should be the best diet you have. Any cholesterol was bad for you. The lower the cholesterol, the better it is, period. We really taught about, well, what's the importance of cholesterol? Why does every cell need cholesterol? Why does the brain have the highest amount of cholesterol in it? We weren't taught. They just taught the lower cholesterol, the better. So they started making these drugs to lower cholesterol, and they're still making them. The PCSK9 inhibitors now are, generations beyond the statins to lower it even further. So I start researching statin drugs, and statins work by poisoning an enzyme called HMG-CoA reductase. And if you look at the biochemical pathway where HMG-CoA reductase is up here, below it are all the hormones. There's testosterone, progesterone, estrogen, DHEA, pregnant, all these things that I was doing on my dad and other patients that were getting them better. Why would you poison the enzyme here? Everything downstream is going to go down because you're poisoning the enzyme. It goes this way. And so you're basically, there's a little funnel up here, and you're limiting the substrate, the cholesterol that needs to be, every cell needs. I'm like, that doesn't make sense physiologically and biochemically. I didn't even have to read a study to tell you that's not going to work long-term in people. It's going to cause too many problems. And so I started researching it, came to, writing this, and
the statin disaster.
And, I find that when people clean up their diet, when they get their hormonal system balanced, do a little exercise, they work way better in statin drugs at changing cholesterol levels. And the reason cholesterol goes up in overweight people who smoke, like my dad, cholesterol is an anti-inflammatory substance. The body's doing its job. It's trying to put out the fire that's going in the arteries because, my dad's smoking and eating and he's overweight, and the last thing you want to do in that case is put out the fireman. It's like saying, because firemen are at every house that has a fire, firemen must be causing all the fires. Well, no, that's not the case. It's there to put it out. And there's another reason that fires are being caused that we need to search for. So I find that statin drugs are a problem. I really don't see a purpose for them in anyone, no matter what their cholesterol. Well, in virtually anyone, no matter what their cholesterol is. And there may be a case with familial hypercholesterolemia when it's super high. But even in those cases, familial hypercholesterolemic patients are born with genetic tendencies to produce high amounts of cholesterol. If those people reach 50 years of age, they live longer than people who don't have familial hypercholesterolemia, no matter how high their cholesterol is. The problem with them is in their younger years, they have a slightly higher risk of heart attacks and death, very slightly higher. So the ones that have super high levels, they might need some therapy to lower the levels. The rest of us, that's 99.99% of us don't need that stuff. But
yeah. Now, another topic that I know you've written on is viruses, which is actually incredibly topical in the last few years. Tell me about how you reflect on the way the pandemic has been handled, and what is the best way of dealing with a virus.
So here's my book on viruses.
Yes. A holistic approach to viruses. Yes. We're going to have links to all of these books, and they're so readable and accessible. I really would recommend them very highly. But go on, tell us about, I'm interested to hear your reflection on this.
So when COVID started in December of 2019, the reports out of China where there were 3 or 4 atypical pneumonia cases with a novel strain of coronavirus. And these people had the same symptoms. They couldn't breathe. They were hospitalized and ventilated, and they died. And so I remember the first report came out in December of 2019, and I followed every report after that. And shortly after that, you were seeing cases in Europe and, Italy and Spain and some other countries in Europe, and some other Asian countries were reporting cases of it. And then in Italy and Spain, it really took off, like wild. In England, it took off like wildfire. And I'm sure you were doing the same thing as we were. We were watching TV and seeing those pictures of the hospital rooms in Italy, and beds 2 feet apart. They're all fully ventilated and bodies stacked up, and they had all the mobile morgues, parked, and they didn't even know what to do with all the bodies. They were dying so quickly when they were ventilated. And so COVID hits the United States in the end of January, beginning of February of 2020. And we had no plan for what to do. We acted lost, and we paid the price for it. And we have an unhealthy population going into it. We're the sickest Western country out there, the fattest Western country out there.
If comorbidities predispose you to the complications, including death, the United States, I think,
we were primed
very low down in the
problem.
area. You were primed for it.
And so COVID hits the U.S. the end of January, beginning of February of 2020, and you could cut tension with a knife from that moment on. And everybody's, we're seeing all the news, and every headline's bad. The modeling out of England was that 3 million Americans would be dead by the end of the year, or 3.5 million would have it, and 1.5 million would be dead. 50% would be dead of those who got it, and by the end of the year, and then more, the following year. So the headlines were there. Nothing was good out there. It was all dire. So the first case hits Michigan in February, the end of February of 2020, where I practice, and my office manager comes to me on Thursday, which is the end of my work week, and says, "You got to talk to the staff. Why? No one's coming to work next week. Everyone's scared." Like, okay. So we have a meeting in the waiting room. I mean, the tension is just enormous. And I've been in practice 28 years or something like that. So my staff had grown with me. We'd gotten older, and, I had an older staff. And I said, "What questions do you have?" First question was, "We're closing the office this weekend, right?" Because everything was closing around Michigan. Everything was closing at that point. And I said, "Closing? Why would we close? Patients are going to need us more than ever. We actually know how to treat viral infections. We've been doing it for over 25 years. Every year when flu season comes around, between 20,000 and over 120,000 of Americans die from the flu and flu-like illnesses every winter season in America. My partners and I cannot recall one patient dying from the flu, and we can't recall one patient being hospitalized from the flu. Now, if we have an average of, let's call it 50,000 a year that died from the flu times 25 years or so, that's a lot of patients that have died from the flu and flu-like illnesses, and we haven't seen it. So we felt like we had a good therapy to offer people, and the therapy was basically supporting the immune system. And with the idea that you don't get over the flu with a drug. There's no drug that treats the flu. There's Tamiflu that doesn't do a very good job, and that wasn't available the first 20 years of my practice anyways, but it's a lousy drug with too many side effects. Basically with Tamiflu, you get a few less hours of the flu, and that's about it. But there's no drug that really treats the flu. It's the immune system that has to get you over the flu, So we've used a therapy to support the immune system, which is high-dose vitamins A, C, D, and iodine. We use nebulized hydrogen peroxide and iodine. And if people needed more therapy, we gave them IVs of vitamin C, hydrogen peroxide, and ozone butt shots. This therapy has been constant for 25 years with a little modification as we learn new things. Ozone was the latest thing we learned about 10 or 15 years ago. And our patients did great. So I said to the staff, we have this therapy. undoubtedly, we've treated coronavirus infection since 1/3 of flu-like illnesses are coronavirus illnesses, although we haven't checked for it. I said, but if it doesn't work for this strain of coronavirus, we'll figure out what does. We got smart doctors here. We got smart people here. We're all going to work together on this. But I said, close the office. I said, you watch. Everything's going to close. Every doctor is going to close their office, and patients are going to have nowhere to go but emergency rooms. And look what's happening in Europe. You go to the emergency room, you get ventilated, you're going to die. 90% chance you're going to die. So I told the staff, whoever doesn't want to work doesn't have to work. You're not going to lose your job. And come Monday came around, we had 50% of our staff there to work. And, about a week later, we got our first case of our patient sick with COVID. I didn't sleep the first week as we started taking phone call after phone call. And we were treating people outside in the winter in Michigan. There was snow, there was sleet, there was ice. And we had flashlights at night. If someone would hold a phone or a flashlight and we'd put the IV in their hand, we became masters at putting IVs in cold people in their hands. We got this whole system down. We'd have 10 cars lined up outside. We had an assembly line going for this. We'd work till 9 at night.
With IVC, with IVC, IV vitamin C.
We'd work till 9, sometimes 10 o'clock at night. We're wearing winter coats underneath all the gear. And there was a little excitement in there, a lot of anxiety, and a lot of trepidation. I didn't know if it was going to work. And started getting phone calls, particularly with our nebulized peroxide, that after the second dose of nebulized peroxide, people were having trouble breathing or low oxygen on their pulse oxes were breathing better. And they were feeling better. And I started sleeping again after about 7 days. And I realized, hey, this therapy is working just like it did for all the other flu-like illnesses. So we've ended up treating over I don't know, we're over 1,300 or 1,400 people now. I haven't done a count in a week. We've had a few hospitalizations. We've had one death, which was recent. We haven't had one up until now. And of course, the one death, they were admitted to the hospital and got remdesivir, which my partner's patient, who he told him not to do this, but, and that was our one death out of, 1,400. And we've kept so many out of the hospital, and, it's that's why I wrote the book. And we had Dr. Thomas Levy on talking about the nebulizer, but just remind us about the dosage, how often one should use that nebulizer. And you mentioned it's with hydrogen peroxide and a little bit of iodine. So we use a 0.03% hydrogen peroxide solution. It's more dilute than what Dr. Levy talks about. But
yes, because 3% is it's quite challenging.
I've had some patients who and some friends who are out of state who just did it right out of the bottle, over-the-counter stuff. I did not tell them to do that. They got better. They had a little more scratchiness to the throat, a little more cough than you do with a 0.03%. But I didn't see any serious problems with it. But 0.03% has been, very safe. It's been very helpful, and with a little bit of Lugol's iodine in there, I think it's the best therapy that we've seen for coronavirus, especially when there's lung problems.
And how long and how often in a day do you do?
Well, I instructed people when they were sick to do it every hour, waking hour, if they could, and then as they felt better, to just taper it off. And most people, what we heard from most people, now this new Omicron strain. Are you guys getting the Omicron strain?
Yeah.
It's not as serious as the original one. They're not having the breathing problems. It's more sore throat, achy. They're just not as serious. But when they couldn't breathe at the beginning, man, that was early into the illness. They just, pulse oxes dumped. They looked gray and they couldn't breathe. They couldn't do anything. What they told us routinely was the second nebulized treatment, their lungs opened up. Their pulse oxes improved from 90% to 95%. They could breathe again. They felt better again. They didn't feel like they were going to die. And that's what we kept hearing routinely through this thing. And but they still have breathing problems. We're hearing that now. But we use nebulized peroxide for asthma, for COPD, for lung cancer, any inflammation of the lungs. I found a dilute solution of nebulized peroxide very helpful. Really, the only side effect I've seen with nebulized peroxide is sometimes a scratchy throat, sometimes a cough. Usually, whatever the cough was, it was minimal. And then after this first dose, it would go away, and they'd be better on the second dose. And
0.03%. I mean, I think it comes in 3% usually from a chemist. So that's quite a dilution. I mean, that's very easy to do.
Very easy to do. It's 100-fold.
Very easy.
It's very easy to do.
And
I'm tired of COVID right now. Let me tell you, I've had enough of it. It's It's not exciting anymore. It's not even anxiety anymore. It's just annoying.
I actually, when it started, I saw this as an incredible opportunity because we had a global audience, captive, literally and metaphorically captive audience, focused on health like never before, being told comorbidities were a problem. And this was a time for real public health measures. But anyway, listen, we could talk about that for a while. We just want to finish up now, David. I want to ask you one last question, taking a step back from your role as a holistic doctor, as an author, because we are all on a health journey through life in this modern world. What do you think the biggest challenge is for an individual on that journey?
I think the biggest challenge is to educate yourself. And part of the reason I started writing books was, I was having to educate people on why these natural therapies should be considered, even though, they're not mainstream and there are other doctors that have no knowledge of them. And I wanted my patients educated. What I found quickly into doing holistic medicine was the patients who got the best results were the most educated. They would do their own research. They would talk to me. We'd have a dialogue. And once they understood the theory behind, what I was trying to do, I felt like I was driving like a bus or a boat or something, and they would jump on with me. And, in every book, I thank my patients for taking the ride with me because, they're taking a leap with me. I took a leap. They're taking a leap with me. And I found that when we're in this together, we'll get better results than when there's, people aren't sure. They're being dictated to. They don't really understand, go take this drug or go take this vitamin. It doesn't, why? They want to know why. They want to know what it's supposed to do. And I think that if they're educated, they can make pretty good health decisions. And if they're uneducated, they really can't. They really don't understand why it's important to eat well, why it's important to drink water, why it's important to maintain salt levels, why it's important to get your hormonal system balanced. And, the patients that seem to do the best long-term are the educated ones. And educated, I don't mean going to college or getting an advanced degree or anything like that. It's just educate about your health and your body. I mean, look, we only get this body to be here with. I don't know if you believe in reincarnation, but maybe we get to come back here again and try it again. We'll all find out somewhere down the road. But right now, we're here with this body. And I feel like we're all dealt this poker hand, 5-card poker hand. Some people are dealt straights and flushes and, straight flushes and good hands. And some people are dealt a lot of crap. And however, whether you're dealt a straight flush or whether you're dealt a crappy 5-card hand of poker, you can play that hand pretty well or you can play it pretty poorly. And you can win or lose on a bad hand. You can win or lose on a good hand. And, you've got to, I wasn't, there's some defects in my body. I got 65 degrees scoliotic curve. I have severe asthma, which, by the way, is gone. When I cleaned up my diet and got my nutrition, I went off all my inhalers. I play tennis 3 or 4 days a week. I don't even use an inhaler when I play tennis anymore. I used to be puffers all the time. And I got an immune defect. That doesn't make me the best to be a doctor. But, I try and optimize what I got. And I've done pretty well for myself. And I feel my patients can do well for themselves regardless of what they're dealt with. And, the people who do the best are the ones that are constantly learning, constantly educating. And people bring me articles, books, I read everything they give me. Maybe I don't read every word of it, but I scan everything they give me and then we talk about it. And, I'm learning just as they're learning. And so look, when you educate yourself, you got to decide what you're eating for dinner. You got to decide what you're eating for breakfast. You got to decide if you're going to exercise. I think if they know why it's important to eat good, why it's important to exercise, they're more likely to do that stuff. And that's played out in my practice.
Well, David, thank you. That's what a great note to finish on because education's what this program is all about. And clearly your career has, with 16 books and everything you do, is similarly. So thank you so much for sharing your time and wisdom.
Thank you for having me, Ryan. This was fun.
Well, we covered quite a range of topics there, of course, and so many of those and more, because David, as I mentioned, has written many books and they are very accessible to patients. So it's interesting that he sees the greatest challenge as being educating yourself, which I guess is why you're listening to this program and actually why I'm doing this program, because I'm educating myself as well. So we will have links to David's site and there is so much there for you to learn. I hope this finds you well. Until next time, this is Dr. Ehrlich. This podcast provides general information and discussion about medicine, health and related subjects. content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.